Hi, welcome to our channel of ignou audiobooks, Indira Gandhi National Open University, School of Social Sciences, SOSS, Master's Degree Programs MA in Psychology, MAPC, Second Year MPCE 023 Interventions in Counseling BLOCK2 Cognitive Behavioral Counseling UNIT2 Application of Cognitive Therapies in Counseling 2.0 Introduction Unit 1 has already described the meaning and procedure of behavioral and cognitive approaches to counseling. In this unit, we will be discussing the uses and applications of these approaches in different types of counseling situations. These two are important approaches to counseling which find wide applications in a variety of settings because of its ease of use and effectiveness. Counselors employ the different techniques under these approaches in contexts ranging from educational to as diverse as military and sports counseling. Cognitive therapy focuses on the relationship among cognition, emotion, and behavior in human functioning. The cognitive approach is based on the observation that automatic thoughts that are exaggerated, distorted, mistaken, or unrealistic play a major role in psychopathology. These automatic thoughts are shaped by an individual's beliefs, assumptions, and schemas. Our perception and interpretation of events greatly depends on these. Irrational thoughts and assumptions shape one's response to experiences and situations, e.g., a child's irrational assumption that, "I am no good," will make him shy away from his classmate, and in the process he will not be able to make friends. This in turn will reinforce his assumption, "I am no good." Hence, cognitive therapies focus on changing the irrational assumptions and belief systems of the clients. In this unit, the cognitive approach, which aims to understand why the client is appraising events in particular ways and why he feels the way that he does, etc., will be discussed. For instance, negative thoughts and feelings about one's situation and circumstance lead to depressive feelings, inaction, and lack of interest in anything. These depressive feelings and mood in turn give rise to negative thoughts in the individual. Thus, it is a vicious cycle of thoughts influencing our feelings and emotions, and again emotions affecting our thought patterns. Sanders and Wills, 2005, point out that an external event will have a very different impact on different people because each individual has, first, a different personal domain on which the event impinges. Second, each person has an idiosyncratic way of appraising events because cognitions, perceptions, beliefs, and schemas will have been shaped by the individual's unique personal experiences and life history. The aim of cognitive therapy is to understand both the person's personal domain and their idiosyncratic way of appraising events. 2.1 Objectives. After going through this unit, you will be able to filled circle develop an understanding of the application of cognitive behavioral therapies. Filled circle appreciate the use of cognitive behavior therapies in a variety of settings. 2.2 Application in different settings. Cognitive behavioral is a major approach in counseling. The basic premise underlying this approach is the idea that automatic thoughts shape both individuals' emotions and their actions in response to events. For example, when the teacher tells the student, "Meet me after the class," the student starts thinking, "Oh, I am gone now. I must have done something serious and something bad will come to me now." Given the presence of this thought in the student's mind, his emotions and behavior will be shaped accordingly. Cognitive therapy tries to bring clients' focus on these irrational thoughts and beliefs and modify them. In fact, most of us have illogical or irrational thoughts, but when we cannot let go of them and they start affecting our actions and behaviors, then it is a problem situation. For example, the thoughts that are problematic for clients who suffer with obsessive-compulsive disorders, OCD, are shared by 90% of the population. Salkovskis et al.1995. OCD sufferers, however, pay attention to these thoughts in a different way. Non-sufferers can let these thoughts go, whereas OCD sufferers cannot. Similarly, those of us who are constant worriers focus more on the worries and cannot let them go. In contrast, many of us who are also faced with the same worries do not let these worries control or overpower us. Cognitive therapy aims at making the clients aware about these dysfunctional thoughts and changing them to appropriate rational thoughts.
2.2.1 Educational setting. Students' behavior presents a lot of challenge to the present-day teacher. In addition to the academic pressure activities, teachers need to deal with such behaviors of students such as student misconduct, aggression, disobedience or disrespect for authority, hyperactivity, inattention, lack of self-control, teasing, bullying, etc., behavioral excesses and deficits affect negatively the academic performance of the students and hamper positive peer relationships as well as healthy relationship with the teachers. Application of cognitive behavior modification in the classroom and school context mainly addresses two aspects, viz. I. Instructional interactions between teachers and learners, and 2. Behavioral interaction between teachers and their learners. Thus, it is made use of in a variety of situations such as the following: increasing academic grades by adopting effective study habits, increasing one's self-confidence to speak in front of a group, increasing social skills to interact with people in the social gathering, following a healthy exercise program, reducing unhealthy pattern of eating, decreasing use of abusive language, example, using swearing words, reducing test anxiety. Different strategies are used such as self-management, applied behavior analysis, positive behavioral support, behavior modification and therapy. Cognitive behavioral interventions, CBI, can be a viable approach for teachers to remediate behavioral deficits and excesses by providing students with the tools necessary to control their own behavior. CBIs involve teaching the use of inner speech, self-talk, to modify underlying cognitions that affect overt behavior. Mahoney, 1974, Machenbaum, 1977. Since theorists consider the internalization of self-statements fundamental to developing self-control, deficient or maladaptive self-statements are viewed as contributing to negative beliefs about oneself, which can contribute significantly to childhood behavior problems, including aggression. Kendall, 1993, noted that cognitive behavioral techniques for the remediation of social deficits can incorporate cognitive, behavioral, emotive, and developmental strategies using rewards, modeling, role plays, and self-evaluation. CBI incorporates behavior therapy, example, modeling, feedback, reinforcement, and cognitive mediation, example, think aloud, to help clients deal with a variety of problems and situations. For example, not hitting or pushing a peer when teased can be mediated by inner speech such as "that makes me mad, but first I need to calm down and think about this." The fundamental assumption of CBI is that overt behavior, example, hitting or pushing a peer when teased, is mediated by cognitive events, example, "I'm going to let him have it," and that individuals can influence cognitive events to change behavior. Cognitive strategies incorporate a how-to-think framework for students to use when modifying behavior rather than any explicit what-to-think instruction from a teacher. Thus, verbal self-regulation, i.e., using self-talk to guide one's behavior to deal with a problem situation, can be effectively used. This is especially relevant to marital problems and family disturbances. Many a times problems arise because the parent reacts impulsively to the child's misbehavior. How can he do like this? How can he not listen to me? Or the couple gets angry and says harsh words to each other immediately. In the event of some misunderstanding, he always forgets when he has promised for an evening out. I only end up tidying the house after a party. In contrast, self-talk can be used to deal with such situations in a positive manner. Example, "Okay, this makes me angry, but first let me think about it." This makes the individual aware of the immediate thought which comes to his mind and gives him time to think about the situation in a clear manner. Hughes Hall, 1989, points out that cognitive behavioral approach can be used to help solve a variety of children's learning and adjustment problems. Example, impulsivity, depression, anxiety, interpersonal problem solving, effects of mild handicaps, problems with arithmetic and reading. For instance, in case of a student exhibiting inattentive Impulsive behavior. The cognitive behavioral therapy may involve a contingence contract which specifies certain contingencies in response to a targeted behavior, and also a component or self-talk which aims at inhibiting the impulsive behavior. Echidite, 1991, studied the effectiveness of cognitive behavior therapy in decreasing the aggressive behaviors of students with emotional and behavior disorder (EBD) as compared to students who did not receive the instruction. Echidite's program components were adapted from the Lochman, Nelson, and Sims 1981 anger coping program, which provides students with a way to change aggressive responses into appropriate alternatives by modifying their thinking processes regarding the circumstances surrounding certain situations. The instruction also assists students in developing, evaluating, and selecting appropriate alternative responses. Echidite's goals included increasing self-awareness, identifying a student's reaction to peer influences, providing avenues to identify problem situations, and using problem-solving techniques to identify, evaluate, and select alternative solutions for a specific social situation. In Echidite's program, students used the following sequential strategy when approaching a problem situation. 1. Stop and think before acting. Students are taught to restrain aggressive responses through the use of covert speech to identify the problem. The students are required to distinguish the specific aspects of a problematic situation that may elicit an aggressive response. 3. Develop alternative solutions. Students generate at least 2 alternative solutions to a problematic situation, either thinking about something else until able to relax and or moving to another location in the room to avoid further provocation. 4. Evaluate the consequences of possible solutions. Students assessed the benefits of each possible solution. 5. Select and implement a solution. The students carried out the selected alternative. Findings showed that the students in the control group exhibited significantly more aggressive behaviors than those who received the training. Behavior management will always be a significant part of the teacher's role and responsibility. Hence, cognitive behavioral interventions comes handy to the teachers to help provide students with methods to successfully control their own behavior. CBI may offer a viable method for assisting students to manage their thoughts and behaviors, thus creating better learning environments and experiences for them. To point to clinical setting, cognitive therapy has been found to be useful in a variety of clinical disorders such as anxiety, depression, substance abuse, personality disorders, antisocial personality disorder, obsessive-compulsive disorder, etc. Freeman et al. 2004 has described the application of cognitive behavioral therapies in a wide range of disorders, which are described as follows. In treating schizophrenia and other psychiatric disorders, cognitive therapy is used in combination with pharmacotherapy, not as an alternative to medication. Cognitive therapy can be used to improve clients' compliance with a medication regimen, to help them recognize their symptoms and cope more effectively with them, to improve social problem solving and stress management, and to treat comorbid problems such as anxiety and depression. Cognitive behavioral interventions are of great significance because of their potential to reduce the costs associated with inpatient treatment and to improve the client's quality of life. Further, cognitive therapy, when used in combination with medication, emphasizes early identification of hypomania and depressive episodes, strategies for dealing with these episodes, regulation of the client's sleeping, eating, and activity levels, reduction of the client's vulnerability and exposure to triggering situations, and enhancement of medication compliance. Cognitive therapy is also used in case of eating disorders. It focuses on the restructuring of dysfunctional beliefs about food, weight, and one's self, particularly in regard to body image and self-worth. Dietary education and monitoring of food intake are emphasized. For instance, in case of the anorexics, cognitive behavior therapy have found much usefulness. The behavior of the anorexic may be characterized by a pattern of social withdrawal, rigorous exercise, and ritualistic eating habits. The weight loss is very drastic. The emotional profile of the anorexic is marked by a pattern of depression, fear of obesity, and loss of self-confidence. Body size misperception is a significant feature of the anorexic disorder. Cognitive therapy with the anorexic involves challenging the faulty thinking and beliefs of the patient. For example, if the patient expresses apprehension around the issue of losing competence if she gains weight, the therapist can help her develop a working definition of competency that will establish a concept of whether or not it is influenced by weight changes. She can be asked such questions as, "Your friend who is a good singer weighs more than you, so would you appreciate her less because she is fat?" This type of questions will gradually make her start thinking about her beliefs and assumptions. Questioning the anorexic about what would happen if their worst expectations came to happen may minimize the imagined effects of the event. The person who wants to be thin is obviously anxious when she considers herself fat. The counselor may inquire, "What's the most horrible thing that could happen if you were to gain weight?"
Cognitive distortions are numerous in the anorexic and must be gently challenged. Distortions such as dichotomous thinking, "If I gain weight, I'll be considered obese." Overgeneralizations, "I will never get any better and my eating will never improve." Magnification, "Gaining any weight will be more than I can take," must be directly, but gently confronted in counseling. The individual may be asked to reinterpret what she sees. The anorexic is encouraged to design experiments to test the validity of specific irrational thoughts. For example, the anorexic individual may be encouraged to interview her friends for preferences in physical appearance, checking out how often people select a friend based exclusively on the merit of weight. Cognitive behavior intervention also finds application in somatiform disorders. This involves changing beliefs about the nature and consequences of the somatic concerns, Salkovsky's, 1989. In addition, coping strategies used for stress management and anxiety reduction are also used. 2.2.3 Personal social situation. Cognitive behavioral therapies have also been found to be beneficial in dealing with personal social related issues. Many a times we are bogged down by our lack of motivation and have doubts with regard to our self-efficacy. "I know I'll make a mess of it. It always happens that way only." Such type of thought affects our behavior accordingly. Cognitive behavioral therapy can prove helpful to the individuals in such type of situations. Anger has come to be recognized as a significant social problem. In the last 2 decades, cognitive behavioral therapy has emerged as the most common approach to anger management. Beck and Fernandez, 1998. Beck et al., 1998, have done a meta-analysis of the various researches conducted during the 20 long years and reported the efficacy of cognitive behavioral therapy for anger management. Cognitive therapy addresses the issue of social anxiety also. Social anxiety is characterized by the following: a misperception of themselves in terms of appearance, ability, and self-worth. B. Feelings of guilt, anger and embarrassment arising from past social situations. C. Think that they have to behave perfectly in social situations. And D. Procrastination habits that exist because of social anxiety, worries and doubts. The systemic desensitization can be used to deal with issues related to social anxiety. The systematic part of systematic desensitization is highly important. In behavioral therapy for social anxiety, the progress must be systematic, step by step, hierarchical, and repetitious. If it moves too fast, or if it is too much, this therapy will not be helpful. It is very important that any process of desensitization be gradual and systematic. Self-assertion strategies are taught to the persons with social anxiety. They are also made to realize through the therapy the need to be more realistic and not to expect perfectionism on their part in social situations. Cognitive behavior therapy also addresses issues related to how to increase one's self-esteem and confidence, how to deal with relationship matters, marital issues, overcoming fears and phobias, and all types of mental disturbances. Cognitive behavioral therapy has been found to be effective in dealing with stress of our day-to-day living. Cognitive therapy for stress rests on the premise that it's not simply the events in our lives that cause us stress, it's the way we think about them. For example, two people may be caught in traffic. While one person could view this situation as an opportunity to listen to music and get relaxed, another person may focus on the wasted time or the feeling of being trapped and become distressed. When something does not turn up the way we had expected, we become upset, which affects our other things also. We had planned to go for a concert in the evening, but could not reach home in time because of some overwork at the office. This creates stress in us. There are hundreds of examples of how our thoughts and our negative self-talk color our experiences and can lead to a triggered stress response or a calm demeanor. Granat et al. 2006, in their study on stress management program, reported both cognitive behavior therapy and yoga as promising stress management techniques. Cognitive behavior therapy suggests that cognitions can influence behavior and that there is a reciprocal relationship between cognition, behavior, and the environment. The personal social problems faced by the individuals have often all these dimensions related to the person's behavior, cognition, and the environmental
cognitive behavioral
situation. Therapy attempts to find out these relationships, makes the individual aware about it, and the irrational assumptions or dysfunctional thought patterns underlying it, thereby facilitating the individuals to deal with their problems. 2.3 Summary. This unit has focused on the application of cognitive behavior therapy in a wide range of situations. Cognitive therapy is a model of psychological therapy that proposes how we feel, how we think, and how we behave are all interrelated, and changes to thoughts and behavior will influence feelings. It makes use of strategies which try to modify the thinking processes of the client in a systematic way so that it results in a positive change in the client's symptoms, problems. The cognitive part of the therapy refers to thinking or learning and is the part of therapy that can be taught to the person. The person then needs to take what has been taught, practice it at home, and through means of repetition, get that new learning down into the brain over and over again so that it becomes automatic or habitual. This is essentially the same process as school or college learning. You are taught some new information or skills, and then you learn them. When you learn them well enough, through repetition, this affects your memory processes and physiologically your brain's neural pathways, and allows you to begin thinking, acting, and feeling differently. This takes persistence, practice, and patience, but when a person sticks with this therapy and does not give up, noticeable progress begins to occur. Cognitive therapy or cognitive behavioral therapy uses a variety of cognitive and behavioral techniques such as CBT, REBT, behavior therapy, self-management, modeling. In this unit, the application of cognitive behavioral therapies to various situations covering educational, clinical, and personal social is described. Cognitive behavioral therapy addresses the thoughts, behavior, and feelings of the individual client. In addition to this focus on the individual's behavior, cognition, and feelings, attention should also be paid to the situation, context, and the environment variables. Thus, an ecological perspective in cognitive behavioral therapy will be more beneficial and effective. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.